In Texas, more than 20% of coronavirus tests are coming back positive, but fewer people are actually getting tested. NBC News correspondent Morgan Chesky joins me now from the Neighborhood Medical Center in Dallas. Morgan, what do we know about this drop in testing?
Yeah, well, it appears to be a combination of factors here, Allison, and we've been at this clinic twice before reporting on the testing situation here in Texas. And I will say that of the 3 times we've been here, this is by far the least busy it's been. And part of the reason for that is the fact that some officials think that because we've seen that basically length of time for a while where it was taking days, even weeks for testing results to come back, it discouraged a lot of people from even getting tested in the first place. The only people that perhaps ended up coming here were those that were truly sick, instead of the recommended procedure of that if you have any symptoms at all or may have been potentially exposed, you were supposed to get tested. There's also the fact that there's been a report that there are hundreds of thousands of completed tests in Texas that have not yet been gone through and divvied up among counties. So there is a lot of questions being raised about Texas's testing situation, but firsthand reporting here, not as many people coming here, and the doctors here at this clinic tell me that it's been going that way for the past several weeks. Allison?
So, Morgan, you say there are fewer people at that rapid testing site where you are. What are you hearing from the folks who are showing up there?
Well, people are trying to be better safe than sorry. The numbers here in Texas are still present a long road ahead. We know that at any moment, unfortunately, Texas is about to break an unfortunate mile marker in the fight against COVID-19, and that is the death toll is about to eclipse 10,000 people. Keep in mind, we have more than 500,000 people here in Texas that have tested positive. And while we're seeing those daily cases and hospitalizations drop off in major urban areas like Dallas and Houston, the fight is still horrible in the Rio Grande Valley in South Texas. Allison?
Yeah, Morgan, let's talk about what's going on in the southern border. This pandemic is hitting that area particularly hard. What are you seeing in Texas's more rural counties?
It's a combination of things. You have, Texas, incredibly vast area. There are just a tiny handful of counties that have few cases there that are kind of located in the panhandle of Texas towards West Texas. But when you do have even small communities there, particularly in rural South Texas, that's where we've seen some of the biggest problems because you have those lower income families, you have scant medical resources, and then once the virus kind of gets hold, it makes it incredibly hard to contain within some of those areas for reasons that we've reported on before, with poor health being cited in that region, on top of the fact that you have children, parents, and grandparents all living in the same household. So in rural communities, we know that resources have been deployed to at least try and help out the situation there. Governor Greg Abbott extending that disaster declaration to make it easier to send state resources to hard-hit counties. But right now, it's still a long road ahead as doctors and medical staff there try to do what they can with what they have to handle the influx of COVID-19 patients. Allison?
Morgan, Hidalgo County sits right on the border. I know you've been in touch with health experts there. What have they been telling you?
Yeah, it's tough. They keep wanting to see kind of a light at the end of the tunnel, and they really have yet to do so. I've spoken with Dr. Ivan Melendez on numerous accounts before. He is the county health authority for Hidalgo County. He advises 5 different hospitals there. And what's interesting is that whenever we were seeing New York City locked down completely when the pandemic was wreaking havoc in that area, they really thought that they were out of the woods down in South Texas. But it wasn't until Texas opened back up in late May that really those numbers started to take off. And at least in that part of the state, while there have been moments where they've been not as bad, it's still brutal. And when I had a chance to speak with him most recently, he kind of described the state of affairs there. Take a listen.
The United States is a hotspot of the world for whatever reason. Texas is a hotspot of the United States. And the Rio Grande Valley is a hotspot of a hotspot of a hotspot. So, yeah, we're in a hotspot. There are 2 options how this ends. We run out of people that die, all the frail, all the elderly. Our populations are decimated the way we are now. The other end, which is what our nation banked on back in February, was to develop a vaccine.
The doctor told me a story about how he left the hospital one night and was planning on going home when he received a phone call from a funeral home director in his small community there who was, as he described it, having an emotional breakdown. He drove over to that business and there was one man surrounded by 90 bodies that had all succumbed to COVID-19. And he says that is the reality that they face in that area. And that's why they're doing as much as they can. They do have several federal medical teams that have been deployed to South Texas to at least try and help out. But the odds are definitely stacked against them, even at this hour. Allison?
It's quite a fight they are fighting there for sure. Morgan Chesky, thank you so much for your reporting. Have a good weekend. Coronavirus cleaning could cost school districts millions of dollars. Some charter schools can afford regular deep cleanings, but other cash-strapped public schools just don't have the funds. NBC News correspondent Jeff Bennett reports.
At the KIPP DC College Preparatory School in Washington, D.C., they're not taking any chances. Deep cleaning is underway. Since April, the KIPP schools, a collection of 7 charter campuses, has been following CDC guidelines closely. It's expanded its janitorial staff by 10%, invested in high-tech cleaning machines and touchless sinks, and purchased 76 gallons of hand sanitizer and 26,000 containers of disinfecting wipes for classrooms.
We are spending between $500,000 and $750,000 per campus.
Although publicly funded, the KIPP schools say they're able to pay for COVID cleaning because they're privately run and had the ability to reallocate funds on short notice when the pandemic hit, a flexibility many traditional public school systems lacked. But even if they could reallocate funds, the price of COVID cleaning for public schools is high. According to the School Superintendents Association, an average-sized public district of 3,700 students can expect $1.8 million in pandemic-related costs for the coming year. In big city public school systems, the price tag's much higher.
We are anticipating spending an additional $60 to $80 million in preparation.
Superintendent of Philadelphia Public Schools, William Haidt, says without additional federal funding, his district will be hard-pressed to afford new CDC-recommended COVID cleaning measures without making painful cuts to other parts of the school system.
If those monies don't come through, we would be looking at staff layoffs, including teacher layoffs.
Philadelphia public school teachers Helen Wilkes and Courtney Love worry the district won't succeed in COVID-proofing their classrooms when it still hasn't made good on years-old promises to rid aging schools like theirs of mold, lead, and asbestos.
We do not have enough resources for a complete cleanup by the guidelines.
Just during a regular school day, there's not enough paper towels, there's no soap. I have students and myself, we bring in our own toilet paper and tissues, and I always have my own cleaning supplies.
Back in Washington, KIPP school administrators say they consider themselves lucky to be able to invest in COVID deep cleaning. The return on their investment won't be measured in dollars, but they say something more.
We have staff that are excited and willing to come back to school, and we have students and families excited to do the same.
5 months into the pandemic, and 71% of Americans say that the coronavirus is still a real threat. But in spite of that, more than a third say they won't get vaccinated. That's according to a new PBS NewsHour NPR Marist poll. NBC News medical contributor Dr. Kavita Patel joining me now. Dr. Patel, what do you make of those numbers? Are you worried too few people will get vaccinated?
Yeah, Allison, I'm incredibly worried. And just to give us a little more context, in general, we have people who, what we call vaccine hesitant or do not want to get vaccinations. But in order for us to get the kind of herd immunity or getting the majority of the community in the United States immunized against the coronavirus, we need at least 50% of the population to get the vaccine, ideally 70%. So that poll and those numbers do concern me, but we do have time to kind of battle any myths or give people better information so that they have confidence in getting a vaccine safely.
There are a lot of questions about Operation Warp Speed, the Trump administration's program to speed up the vaccine process. A House committee is even investigating whether the operation is as transparent as it should be. How do you get the message across to Americans that this potential vaccine is safe, even as it moves along so quickly?
Yeah, and again, this is Operation Warp Speed for a reason. Normally a vaccine takes 10 to 12 years to develop, and all these phases of trials we're talking about happen one after another. And doing this in less than a year truly is warp speed. So I think a number of scientists and health professionals have said that we want to make sure we get a vaccine as quickly as possible and as safely as possible. I think the key here is to really remember that transparency is going to be paramount. We should have access, myself as a doctor, access to the data that supports the effectiveness and safety of those vaccines. That's exactly what the scientific community is calling for from the Food and Drug Administration, and I fully expect that that data will be available when Americans roll up their sleeves to get a shot in the arm. And remember, Allison, we're looking at least 2 doses that are 30 days apart. So this vaccine hesitancy is concerning because we really need Americans to be comfortable with getting 2 doses, 2 shots, and I think we have time, but not that much time.
Dr. Patel, here's a viewer question for you about going back to school. They want to know, how should kids actually get there? Should parents be dropping kids off and picking them up, or can the school bus actually be a safe option?
Yeah, it's a great question, Allison. I'm struggling with exactly that question for my own children. And I would say that the safest option is the one that you know that your children will be at least compliant with instructions to wash their hands and to minimize contact with other people. If you have an older child, being on a school bus might be more realistic because you can tell that child, you know, you're not allowed to sit next to your friend, you have to wear your mask, and you have to make sure you use that hand sanitizer that mommy or daddy put in your backpack. That is not feasible for my 5-year-old, for example. So I think that it's really going to be age dependent. And then I will say, as a working parent, you need to do also what's practical and understand the risks of that. If you have no option but to allow your child on the bus, have a conversation with the bus driver and say, you know, I know you take care of my precious life every day. Please, please do what you can to reinforce that, you know, I want them to stay safe, and just be honest about your emotions.
Tough decisions for so many parents to make it. And as you said, I know you are one of them. Joe Biden and Kamala Harris are calling for a 3-month nationwide mask mandate to contain the spread of the coronavirus. What do you make of that, Dr. Patel? Is that a good idea for us?
Yeah, I mean, look, all politics aside, the science has been clear. There has been, and remember, Allison, I think I was with you when I said, you know, don't use a mask unless you're a healthcare professional. We've now got 6 months of data that shows that using a mask, even if half of us use masks, we can cut the rates of infections. So a national mask mandate, while it might not be legally feasible, is exactly the right message. And it's one that I can tell you all of us in the healthcare profession support.
We want people to be wearing masks to keep themselves and other people safe. Dr. Patel, I know it's a message you've been sharing with us for quite some time. Thank you so much. Hope you and your family have a safe and healthy weekend.
You too.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.